Hello, and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative, interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. Hello. Today we are joined by Professor Deb Fitzsimmons, who is a Professor of Health Economics and Outcomes Research Director for Swansea Centre for Health Economics, also known as SCE. As a team, SCE have substantial track record of leading health economic evaluations on interventions and technologies for people living with complex and lifelong health needs. They currently have a portfolio of over 40 live projects and trials and work in collaboration across Wales, the UK and internationally. Deb is also co-director of Healthcare and Care Economics Cymru, funded by Welsh Government via Health and Care Research Wales. Hello, and thank you for joining us.
Thank you for inviting me. It's a pleasure to be here.
It's lovely to have you here. Can I just say, wow, to over 40 live projects and trials ongoing at the moment.
Yeah, it keeps me busy. Please don't ask me to recount every 40, but I did count and we have got 40 projects at the moment.
Wow. So,
and that changes all the time.
Really?
Yes.
That's an impressive number just on its own.
Yeah.
So it goes up and down, I'm assuming?
Absolutely. We, we're keen to develop our collaborations with others, lead our own projects, and so essentially we're a research unit trying to make a good impact through delivering great research.
Wow. Well, I guess my first question really should be, can you tell me a bit about the centre?
Yeah. So thank you. So Swansea Centre for Health Economics, SCE for short, comes from a sort of long track record of health economics research here at Swansea, started by Professor Kerry Phillips many decades ago. SCE was formed in around 2011 by my colleague, Dr. Pippa Anderson, so tribute to Pippa and all the work she did to set us up. And we've worked across Wales, across the UK, internationally in terms of supporting and leading projects and evaluations that need to understand, how we allocate our scarce resources. Obviously, we're in the business of health and care, so it's our scarce health and care resources to try and get the maximum benefit for the people and populations of Wales and beyond.
That's just... and are you able to just sort of give some examples of some of the research that you've got ongoing at the moment, or are you...
Yes, of course I can. So I give you some. So we have a breadth of portfolio. I mean, our strapline is sort of real world analysis driven. So we're always trying to apply our health economics thinking and methods to some of those real life, real world challenges that we all face within health and care and beyond in terms of wider society. So for example, a trial project would be where we come in and support a new trial of a technology or intervention. An example might be a new intervention to support people with cancer. And we would try and work with the trial team to conduct the evaluation, to look at the costs and benefits of that new intervention, to see if it provides value for money. So where we would look at, say, clinical effectiveness in a trial, we would be the team that looks at the cost effectiveness, that value for money. And then that might then be part of that evidence package that you can take to clinicians, you can take to decision makers, you can take to managers, etc., and commissioners in the NHS to say that this is worth investing in. So that's the trial. Other things that we do, right down to sort of more smaller scale, this is work that we really, really do enjoy, is where we are able to help sort of our local health boards and teams in terms of understanding how we can make a difference and impact to improving outcomes for people here in Wales. So we would work with them on new pathways of care and trying to help them to understand where those sort of trade-offs or costs and benefits might lie, again to support their business case or the evidence to maybe scale that up across the country. So we from sort of small scale local evaluations right up to large programme based trials and real world studies. We cover the lot, really.
You literally go from this from start to beginning and just grow? And because in the introduction, it was across Wales, the UK, and internationally.
Yeah, absolutely. And I think that's what really we love. We're a fantastic team in terms of our diversity, and I think that's what we all enjoy about our work. It's varied. We get to work with so many people. We get to answer some really important questions to sort of support the delivery of health and care at the moment. And I think that keeps us going in terms of, we're always excited to see what the next project might be and what we can help in terms of delivering that evidence to support, making good decisions in the future.
That's quite a big drive as well, isn't it? So you need to have the right team of people around you. And I would imagine you've got quite a big team if you've got that many projects.
No, we're quite small, but
are you?
I am. But it's health economics. It's not just about sitting in front of the computer. Doing analysis, that's really important, but what we can provide is that thinking from the outset. We've had so much experience. We're also pretty good now at sort of designing sort of evaluations and research and trials in the round. So we work very closely with trials units, for example, in trying to sort of develop that grant application. And that takes us through to the sort of methods that we use then, ranging from, fairly sort of qualitative methods in many respects to sort of help try and design some of the resource use measures or the economic outcome measures that we need to use, right to some very advanced sort of mathematical modelling to help quantify those costs and effects. So because of that, we're a diverse team in both our sort of skills and experience. We come from very different backgrounds.
I was just going to say, there's a lot of backgrounds in there, isn't there? Yeah. Do you think like having that small? So you just said it's a small team.
Yeah.
Diverse but small team. Do you think that's part of the success of your centre?
Yeah, probably, because I think it's about, we pride ourselves that, not only do we collaborate within a team, we come as a collective, and we'll bring you the right skill mix to address your research question or indeed answer our own. But bringing that together and then again, working then across with other people in that sort of very multidisciplinary, interdisciplinary sort of mantra is what we're about. We're very applied, but that's what we enjoy. It's working with others and answering some and helping to address some really important research questions.
And would you say there's a high number of your projects that are collaboration? Are they more collaborative?
I think everything we do is collaboration.
Everything.
I cannot think of one project where we've not worked with others to help address. We can't do.
Yeah.
Otherwise, it'll become meaningless research. If we're asking about costs and benefits and we've not talked to the clinical team, for example, we've not talked to the trial team in terms of how they're sort of addressing clinical effectiveness. If we haven't talked to patients, to carers, to the public about what we're doing, then our work won't have that value. So we're very much about applying our thinking and methods to try and make that meaningful difference.
And that collaboration, then, do you think that has contributed to the impact that you've been able to have across the board?
I'd like to think so.
Yeah.
When we enjoy what we do, and we're really proud when we can see that we've made a small but important difference to, say, a new technology being seen as as important to invest in, or a new service has been established. So it's so small. Yeah. Being part of that is probably what makes us really enjoy the job.
And sometimes when you're collaborating, because people have got different skill sets, it can set things in a completely different direction that you hadn't anticipated as well, can't it?
Absolutely. If you look at the Research Institute, just getting people round the table from different lenses, different backgrounds, different experiences. What do they say? The sum is greater than the sum of the part.
I know. I was going to say the opportunities are endless.
Yeah,
aren't
but
they?
just exactly. Getting people around the table, talking, looking at new, innovative ways, and thinking about robust solutions to try and address that question as fully and as appropriate as possible. I think that's just it's a joy to do.
And that's sort of like the ethos of what we want to achieve in the healthy ageing and chronic conditions. So it's really nice that it's embedded as one of your values for the SKI project as well.
And we cut across so many disciplines ourselves, but we also see us in terms of we can help others, and we can lead and sort of mentor others to develop that research portfolio. So I think that's what SKI I think it can bring to the Research Institute table in terms of our experience, our diversity.
Yeah.
learning lessons, good or bad, on the way, isn't it?
But so you need to learn bad lessons to make them.
Absolutely. And I think that's what is exciting about, being part of the Institute.
Yeah, and it's a huge sort of advantage as well, isn't it? Because you have the opportunities to learn those lessons, but you have the opportunities to have other ideas and to get. Do you have an awful lot of interaction with patients directly, or is yours mostly, because you do trials and stuff like that, or is yours more isolated to within your centre?
No. I mean, I think the days where health economists worked in isolation and didn't talk to people, I mean, we're not one of those groups. There might be others, but I think that world. I think like other disciplines involved in health and care research, we've had to go out there, we've had to reach out, and we're so much better for it. So, for example, you mentioned I'm the co-director for Health and Care Economics Cymru. Well, we have our own sort of patient and public involvement group, an engagement group.
Yeah.
So we would go to our public colleagues and share some ideas for research and ways that we can make sure that as we're developing our research, health economics can be a bit of a tricky language, to be honest, in places, and people would sometimes see it as very highly technical and quantitative. It needs to be that.
Yeah.
But, we've also got to make sure that we communicate what we're doing all the way through our research, particularly, and towards the end when we're sort of trying to use our research and make an impact. We've got to make sure we're communicating to people so they understand what we've done and why we're doing it the way that we do. So that's really important. So patient public involvement now and engagement is integral to our life as health economists.
Has that kind of shaped some of the designs, because you said those days are long gone? Is it very different to look at now to what it used to be?
Absolutely. I mean, I think my own background. So I started off not as a health economist. I thought that would be another podcast in terms of how did I end up here.
I'll book you back in for that one.
We have it, yeah. We'll need a long one there, but that's interesting, isn't it, in terms of how people bring their backgrounds and skills. But my sort of first research love is patient-reported outcomes. That's heavily involved in terms of co-producing measures to try and capture what's important to people and patients and care, or whoever our group is. And so I've probably always had that sort of patient involvement in the core of me as a researcher. But what is nice now is that now is sort of now underpinning our work as health economists as well.
And it's nice that does underpin it, because ultimately the impact you're trying to have is for that target audience group, isn't it? So it's really nice that they are involved.
Absolutely. At the end of the day, we work within the UK. Health and care is largely, mostly, if not all, funded by the public. So we're all stakeholders in what we do. So if I can't communicate what I'm doing as a researcher to try and demonstrate that new intervention or technology is showing value for money for the NHS and society, well, that ultimately the people I need to make sure and convince is us, the general public.
Yeah. So you kind of, in essence, you benefit from your work too.
I can safely say I might have tried, but I can safely say there's very little mates rates in terms of doing a favour to the NHS and getting something back in return. No, I've never jumped to a waiting queue ever.
No. And rightly so.
Rightly so. I mean, I would not be a health economist if I did that, because not only do we look at efficiency, but we also need to look at equity as well, to make sure that whilst we're improving outcomes, we're also trying to reduce some of those inequalities in care that we sadly see so much in today's world.
And ultimately sustainability.
Absolutely. And I think that's the one of the other things that we bring as a team, in terms of, because we've got these diverse methodologies, not only can we look at about the here and now, but we can also look and project or scale up in terms of what would happen if you say roll this service out over the future, and what would that bring. Health economists very much sort of value prevention. There's the economic case for prevention is a no-brainer. And so we very much have that public health sort of context sort of built into us in terms of how we apply and think about the sort of benefits that we bring to society.
So on that, what would you say to someone who is interested in health economics? What would your
come and talk to us. Don't be put off by thinking, these economists are sort of aloof and not involved in the real world. We are. We want to support people with their research. We can bring a lot to the table in terms of helping you with that thinking and design. Sadly, the days of never needing a health economist are still a little bit away. We have to tackle and make difficult choices about how we allocate our scarce health and care resources to get that maximum benefit. So even at the beginnings of, say, the life cycle of your research, come and talk to us. And even if you don't need our input right there, right then, there probably is a time and a place where we can hopefully help and support your research endeavours.
And we've kind of gone full circle because it's back to that creating those opportunities and new ideas as well, isn't it?
Absolutely.
So with complex health needs, are you able to just give me a few examples of some of the complex health needs that you support in your trials at the moment? Or
yes, so we've got work. So at the moment we've got we're working on a National Institute for Health and Care Research programme grant. So it's one of those big programme grants over many years, and several millions of pounds. So we're leading the Health Economics work package on that, and my colleague Catherine is the programme health economist on that. That's with University College of London, and I'm pleased to say that our very own Professor Andrea Tales is also part of this work as well. So again, we brought a consortium together and got this funding. So that's looking at people with rare dementias, which are the underrepresented group, and we're looking at three populations there with different healthcare needs. So people, and it's about developing digital interventions to support their health and well-being. So one population is people who already have a rare dementia, but we're also looking at carers as well as a distinct group, and we're also looking at people who are at risk, so maybe know that they've had a genetic test and know that they're at risk. And so that's looking at, so the complexity of those healthcare needs change depending on where you are on that sort of continuum of that sort of dementia experience. So we have sort of designed new novel ways of trying to capture resource, what important resource use, again working very closely with patient and carer groups from the outset. So Catherine's led a Delphi study, for example, there, and now we're embedding that work and that understanding then into supporting the delivery of the trials. So there's different trials going on, and that's where we're evaluating the cost effectiveness of these various digital interventions that they're evaluating.
Because we are moving into an older age demographic profile now, aren't we? People are living older and more people are getting diagnosed with some of these.
Absolutely. And again, we've talked about, we're health economics sits very comfortably within that public health context. It's about taking that life course approach. In health economics evaluations, we're often talking about taking that lifetime horizon. Because, so for example, a lot of my work is with people who've at risk or have been diagnosed with cancer. That can have a lifetime effect on you. So, for example, you might have very curative treatment, okay, but the costs and benefits will be traded off that you might get lots of side effects and late effects over time, okay? And so your benefits in terms of your quality in life might ebb and flow as well as that. So very much about looking at people with those complex health needs. We've done lots of work in diabetes. We've got lots of programme grants. I don't know why I keep going for these long terms. I'm thinking,
because you're a successful centre.
Well, yeah, so it's like, I'm thinking, I want to retire soon. It's like, you start seeing there's like, another 7 years, you're thinking crumbs. But we're doing lots of work with asthma. So we've been part of the Asthma Centre, Asthma UK Centre for Applied Research. So we've been working with Edinburgh on some big project. That's Sim2Art. That's coming to an end, and we're looking at the next set of studies coming from that. We've been working with Nottingham and others on sort of cognitive rehabilitation for people with multiple sclerosis and other sort of neurological conditions. So so as I said, lots diverse. Absolutely.
You can see why I'm still in shock that it's such a small team in terms, know,
Yeah.
because the diversity that you talked about right at the very beginning, you can see why it's essential if you've got all these different things.
Absolutely. We were just like keeping busy, I guess, isn't it? Keeps me out
Time
of trouble.
flies when you're having fun.
Keeps me out of trouble.
Well, something's got to, I guess. Well, I could honestly sit here for longer and hear more about some of these. Maybe I'll have to invite you back and we can do some
I think
more.
it'd probably be better than not to have me talking again. But
I'll get some of your colleagues.
Get some of my colleagues, because they deliver the work and they do a brilliant job. I'm so proud of my team. They're fantastic.
A good value to have in a team, isn't it? You mentioned that people can get in touch. So because this is a very interesting topic, are you happy for people to reach out to you via your staff pages or the centre itself and just...
maybe not the staff page because it's not the most up to date, but definitely share my email, reach out and, come and talk to us, find out a little bit more that we can do and, how we might be able to support your research.
Thank you so much for coming in and talking to us and sharing all these wonderful things.
That's all right.
I really enjoyed having you in. That's all from us today. If you've enjoyed and would like to follow us, find out more about this podcast at Swansea University Research, and please follow us on there. We are under the Medicine, Health and Life Science Research Institute of Healthy Ageing and Chronic Conditions. Thank you for coming.
All right, thank you.